Saturday has been amazing so far. Welcome to yet another episode of Doctor's Call, where we give you advice and tips on the various health issues affecting us. We have been talking about a series called Mental Health, an important series that is often not talked about, or rather society shies away from. We have talked about what mental health is, and on our previous episode we started on depression. We talked about what depression is, we talked about the causes of depression, and on this episode we want to continue and know more about depression. And I'm joined again by the lovely Yvonne. Yvonne,
thank you, viewers. Pleasure is on mine, Gladys.
Okay, Yvonne, last time we were talking about the symptoms, and we didn't get to quite completely finish all the symptoms. So we talked about, you can brush through the few we talked about and then we can continue.
Yes. Thank you, viewers, for joining us again. My name is Yvonne Kilgora, a clinical and public health specialist and also a mental health advocate on mental health literacy. So last time we covered a bit of signs and symptoms, and today we are going to cover more on them, so that we understand what the common ones that occur. I will start with the ones that we actually discussed, and some of them were talking about the feelings of irritability. We talked about people feeling guilty or helpless. We are going to continue to talk about when people actually feel a bit of anxiety. Yes, you're sad, but the sadness, due to something you're anticipating, can be a bit anxious. You cannot be able, sometimes you're unable to concentrate on a few issues, maybe in your work, or even in schoolwork, or even in your relationships. Some people can have a difficulty in sleeping. Some people can sleep a lot, some people sleep less. Others can have issues with eating. Some people can eat a lot, some eat less. You find that a person who's depressed, you're sad, the things that you are used to doing normally, you're unable to do them. Like, I love writing, drawing, making lots of noise and being very happy. There are times that there are times you find that you're unable to even watch even a movie. And even hang out with your friends. And also you find people have an issue with the lack of energy. It's morning, Gladys. You have to go to the studio. At 8 you should be there, but you're thinking, let me call in sick. And it's not because that you're tired, it's because you actually slept, but you're feeling just tired. You don't want to do anything. And I will tell more of the symptoms when we call of my symptoms when we go to the diagnosis bit. Sometimes people might have physical symptoms, and we'll go to the bits of whereby when what will a person who is going through depression talk about, so that you see we talk about these things so that people can have knowledge and can know when these things are coming, because somebody not come and tell you I'm depressed when they can't diagnose themselves. Yes.
But Yvonne, you see, based on the symptoms you just stated, isn't it rather easy to assume I'm not depressed? Because if today I have no energy, maybe it's just today, maybe I woke up on the wrong side of the bed, isn't it easier for us to justify some of these symptoms as being other things than what it is?
Exactly. I remember last time we talked about what depression is. It's a sadness, prolonged. And one day, 2 days goes away and has no repercussions. That one you can slide off. But this one affects the brain. Remember the brain functions? Your physical activity, your thinking activity, your passiveness. And these are things that take a toll on your life. You're unable to do your work. You're unable to, maybe if someone is taking care of their parents or children, they're able to take care of their children. They're unable to do their work, like maybe people who are, let me see, apart from work, you have a certain task, you're unable to complete it. These symptoms can also occur in a person who's not having depression. But what makes us know it's depression, it's the history. That's why you go for diagnosis, because you see history, it takes some time. You see the duration, the frequency of the condition that is actually there, and that's when we make a definitive diagnosis. This is depression or some other form of mental health illness.
Okay, now that you've talked about diagnosis, let us now get to diagnosis. How do you diagnose that this person, this is depression?
Depression. So we'll get that diagnosis, one, a person might, let me say, talk about what people might actually talk about. Some people might say, I feel hopeless. You're like, maybe you're just having a bad day.
Yeah.
Some people might say, I've lost interest in, I don't want to watch this movie again.
Yeah.
You lose interest. Someone can say, I'm having constant headaches. I don't know what's up. Could be a migraine, could be a stress headache, could be anything.
Yeah.
But these are the things that a person will actually tell you. But of course, you'll have to manage the symptom and take good history for you to even know what's happening.
Yeah.
Others can say, I feel worthless. That's why you're like, okay, you feel worthless. It's not a common thing to feel worthless.
Yeah.
So you'll actually ask further, when did it start? Any major thing that has happened in your life? Is it the first time? Then someone might also say, the things that make me happy no longer make me happy. I love chocolate, dark chocolate. So if you give me chocolate, I'll be excited. But you give me dark chocolate, I'm like, I'll take it later. I'm like, something is wrong.
Yeah.
And of course, sometimes due to the depression, the grades might not be doing well. Your performance at work also may be slagging. The diagnosis. These are just some of the things that a person can actually talk about, can mention. Diagnosis has to be done by a professional. I always insist, a professional mental health practitioner, not anybody, not Dr. Google.
Yeah.
But we have a lot of internet quizzes that actually people use to see some symptoms. Although we prefer you see a doctor because a person who's going to take care of you and know to diagnose you properly. In case there's help, they help you there and then. Okay. So when it comes to diagnosis, you've gone. I know people are going to chemist. Gladys, I don't know about you. Yes. I'm just feeling having a headache. It's easier
than having to
it's
go to a hospital.
Yeah. All right. It's our habits that actually let me say, are harming us more.
Yeah.
The diagnosis, number one. Number one is a person goes through a series of questions. Let me say, it's a health assessment. As we discussed, let's now discuss the expert patient. I've had depression or something because I thought I had everything because I'm knowledgeable. Yeah. And for me to end up to a psychiatrist's office, this is what happened. I could not work. I'd wake up tired. All these symptoms. And Bekifika Satisa, you're supposed to leave work at 5. It's at 3, I'm like, I am done. I can't close the next 2 hours. You see, and your work is seeing patients. Yeah. And you can't afford to be tired yourself. You're managing life. I saw this thing. I tried some few copy mechanisms which I've not mentioned today. It did not work. There's something I was working on. I love writing. I was typing something. That day I said, let me just go and try to finish up that chapter or something. I opened the laptop. I tried to type. I can't. I tried to, let me proofread my work and do some typo correction. I can't. Let me try watching a movie. I just slammed the laptop. Closed. Then I realized in this process, I used to be asleep by 6 p.m. Work ends at 5 and I have to travel. But by 6 p.m. I was in bed, having eaten and showered in bed.
Okay.
So something just happened. And that's when I discovered I was going through a breakdown. And I was like, finally, it's caught up with me. Let's look at it. Previously, I had tried all other exercises. You're trying to keep sane. You're trying hard. Because you see, this thing I can ace, this thing I can ace. Because when all these things didn't work, I went to a psychiatrist. And on going there, of course, psychiatrist is like, she was a very lovely lady. Dr. Tunakujua. And she took me through the assessments. And she asked lots of questions, and after that, she graded me to where I fit in the categories.
In the types now that we discussed about.
Yes, and how far it's been there, the severity of it. And for me, I took myself. Let's remember that 5 years prior, I had gone for the same thing. I'm having headaches. I even did an MRI, things were done. But you find that despite all that, I was told the last option of the physician was like, would you like to see a psychiatrist? I smiled and was like, I would think about it. Which one would you like? Male, female, male, old or young? Older. I never went. This is 5 years ago.
Mm-hmm.
So you find that it took a further 5 years surviving somehow,
Mm-hmm.
and finally it couldn't take any longer.
Yeah.
And after the assessment, the diagnosis, then of course I was told you'll be put on some medication. And then of course there's a disclaimer.
Mm-hmm.
This thing is curable.
Mm.
And as much as it is curable, you're going to take it for some time.
Mhm.
Because I asked, how long will I take the pills? Because
Mhm.
I was also trying to get a pill because
Yeah.
I was looking for something to take away the feeling, not the sadness,
Yeah.
and the tiredness. I could not sleep at night.
Okay.
So I was looking, and I'm at work. In fact, I asked myself, you have a good job, everything's fine in your
Yeah.
life. So it didn't make sense for me to be going through something
Yeah.
at the moment. Once you're coming mental health, you cannot see. You just see the symptoms, you assume, go forward, and things can change.
So let me ask Yvonne, through all this, when you're going through and battling this,
Mhm.
did you ever talk to your family and friends? Did you come out to them and tell them, this is what I'm going through, this and this is what I'm feeling?
My friends here will now be against me.
Mm-hmm.
For the longest period of time, let me say after high school, you see, high school was a different environment,
Mm-hmm.
and I got delusions.
Mm-hmm.
People were nasty. I was used to watu ni wazuri, watu wa kanisa, mufai kutusi mtu. So when you go there, hey, the shock I encountered, I think I just got shocked kabisa. People could steal clothes. That thing, those things are things I'm not used to seeing.
Yeah.
I was in a very controlled, good people society. And after high school, I tried to talk to some people. I normally have episodes of sadness. Unfortunately, I talked to the wrong people.
Yeah.
The apparent friends I had.
Yeah.
And they're like, people get sad.
Yeah, ni kawaida.
Let's move on. So when I was working now, I had friends.
Mm.
And the only person who ever knew of what I'm going through is a physician, because I was like, hey doc, I have these symptoms that I've been there for so long. I even used to think I'm hypertensive, my eyes have an issue because you have migraine headaches. No, there's those headaches that don't go. And you tell them, these headaches don't even go.
Yeah.
So I got some meds.
Mm.
And the meds I got were antidepressants. So I smiled. I was like, so I have depression. So I didn't tell it to my friends.
Mm.
I think when I look at it, I'm used to solving things on my own, which I've been told is a very bad quality of a person. And you're supposed to talk to people, family and friends. It's easier said than done for me as a person. So when this time when I had the major breakdown, which I call it a major breakdown, I just looked for my friend and like, by the way, it's like it's at Kenyan way. By the way, I'm on therapy for depression. I was like, Ilianza. Yeah, like it's been there. You even trying to say it, you are unable to say it as it should be. It's been there. And they're like, we didn't even say it. And they're the closest friends I had.
Yeah.
Because they couldn't see it also. Because you see, we are able, maybe not cover up, we are able to deal with it. We try.
Yeah.
And unless someone speaks out, unless you notice something is amiss with the person, you will definitely follow through. I am privileged to have a journal since high school. There's a day I went through one journal, I didn't finish. I looked at it and I was shocked. And the things I was writing, and nobody saw anything. That's how serious mental health and illness is. So whenever I look at them, I'm like, yo, we made it somehow.
That is proof that depression can actually be a silent killer if unmonitored.
Kabisa.
Well, earlier in our previous episode, we talked about the brain and how it contributes. Then there's this chemical produced that affects mood.
The neurotransmitters.
And I think it's called serotonin.
Serotonin.
So is there a way it affects depression? Because it is produced to help with our moods. It affects our moods. So does it in any way affect depression? Yes,
it does. And you find that as much as it does affect the way we actually have the depression coming out, in fact, the modes of treatment that occur is that we are normally given the types of medication. We'll discuss the types that come. And some of them are, we have several non-serotonin,
Yes.
angiotensin inhibitors, and we've got tricyclics. They're quite a number. And these hormone effects, but at times we have other also, this is the commonly associated. We have others that also affect, like also the dopamine. So you find it depends on which one. That's why the practitioner is going to give you the medication. We'll know which one to target.
Okay.
Because of the presentation.
Yes.
Yes.
Okay. Our viewers, we're going for a short break. We'll be right back to tackle more on depression and the care to be given to people suffering from depression.
Oh, I just need my one-on-one time with you. I might be selfish, but I just can't. My God.
Music that uplifts your soul, that makes you wanna dance and worship your living God. That comes to you on every Friday, 9:30 to 10:30 p.m. Worship and cut.
Welcome back, our viewers. Remember, you can follow this conversation on our social media platforms: Facebook, Riverside TV KE, YouTube, Riverside TV Kenya. And Yvonne, before we get back to the care of mental health, of depression, I had a question. A recent study revealed that wearing masks lowers depression. Like, in a pandemic now, and the state of mental health has increased because, you know, the different types of mental disorders are now more prevalent than before. But people actually said that wearing masks lowers depression, because if I'm feeling sad, I don't have to fake feeling sad. I don't have to fake all these other feelings. Is it true?
Wow, that's an interesting study. I don't know which population it was done for.
Yeah.
I'll look at it. Wearing a mask, well, it hides, we have our muscles, our facial muscles. And the facial muscles can give us various expressions of sadness, of happiness, and it's not just, and of course, the smile. For people who want to hide behind the masks, like I do, because one thing, it's safe, right, from COVID. And the other one is because, you know, you don't have to smile any longer. You know, when you're sad, you're sad. Even if you're going for a photo shoot, you're just sad.
Yeah.
Just look at it and you're sad. And it is difficult. Maybe the study, maybe if we do it in a I hope it was in Africa. Because if it was in Africa, we can now know. Was it in Africa?
Yes, it was actually in Kenya. Yeah.
That's good to know. But if at all the wearing a mask is making our mental health better, I think it's okay. But I hope also, as much as it's going to hide what we are feeling, let the people get help.
Okay.
Yes.
Okay. Now, I'd like us to talk about the care of mental health. How do we care for patients suffering from depression, and especially now, the care on a normal basis, and the care now, especially in a pandemic?
For the care, we'll have to say this. We see after the diagnosis by the doctor, you'll be given some meds, most likely. And what you're supposed to be seeing whoever you're seeing, the practitioner, oftenly, depends. And if you're encountering any side effects, you actually state them out. As an expert patient, there's a drug that I was given, and this one is taken during the morning, but it didn't work for me. So when I went back, they're like, since it's not working for you, let's try at night. Okay. You see, these things are different completely. And of course, you'll be given to a psychotherapist to help you through. The work of the psychotherapist is to help you now cope up with the stresses. Maybe it's your family that's having an issue, maybe it's your schoolwork, maybe it's your work. If you have a bad boss, you can actually go into a mental health challenge. So the those are this is now the healthcare perspective.
Yeah.
And now comes to the support.
Yeah.
at
The
home.
friends and family now.
Friends and family. So people like us who don't like talking to friends and family,
Mhm.
we like solving our issues. It
Yeah.
is tricky. But what I'd say that there's always one person that you talk to. No man is an island, they say.
True.
And that might be the person who will help you through. In this pandemic, you go to someone, I'm having a small issue, they tell you everybody has problems.
Yeah.
And people just like brush you off,
Yeah,
problems.
yeah.
It becomes a bit difficult. And that's why some organizations have come up and they're giving free toll services, free toll service counseling for
Mhm.
people who are going through issues.
Yeah.
And I have referred some people to such programs and they tell me they started their counseling. And let's not forget, any illness has a cost predicament to it. So you find that even accessibility of this care is not there. So when talking about friends and family, some will not understand what is this mental health.
True.
And they'll wonder, why are you getting depressed? We've never been depressed. You're the
Yeah.
only one in the depression. So what is wrong with you?
And
Can't you handle it?
especially assuming you had suicidal thoughts and you come out to these people and you say, this and this is what I've been feeling.
Yeah.
Most of them tend to wonder, what about us? You wanted to kill yourself, what about us? They really don't look at it from a you perspective, rather
Yes.
from a them perspective.
And that's why we say people in this world are selfish.
Yes.
We are working on to make people be kind and compassionate to other people. If we were all kind, we'd have less evils in the world. Yes. So the good support system, as we talked about, people will hang out with you, they will listen to you, they will talk to you, and there are people who will notice something is wrong. Gladys leo hacheki. So we're like, hey Gladys, are you well? That's the first question. I'm not feeling well. Would you like to talk to someone? You know, there's a way you approach this aspect. It's not because Gladys cannot handle it, but clearly, if she needs the help, we'll try to help her as much as we can. Yes.
Okay. Now, depression has been classified as an illness like any other illness.
Yes.
So, is there also foods that depressed people should eat, like how a diabetic would eat certain foods?
All right, that's a very interesting question. We have various, talk about depression is more of a chemical imbalance, and there are different types of foods that people should actually eat, and because of the various minerals that are required.
Yeah.
One of them, of course, we have tryptophan, is a mineral that you can get in chicken or turkey or soybeans. The other one we have is vitamin B9, found in the green leafy vegetables, the spinaches, the lentils, the beans. We also have things to do with the carrots, because they give you beta carotene, and on some of them, red, orange looking vegetables.
Yeah.
We need a bit of the omega-3 for your health. Of course, you get them from the mackerel, the seafoods, the tuna, and also we've got something like to do with vitamin D. Vitamin D, you can get it from the sunlight, or you just take the fortified in cereals or even the eggs.
Yes.
And of course, we need some bit of selenium. Selenium is known to help a lot of chronic conditions. We can get it from the brown rice or the beef. Yes.
Okay. You've had the different types of food you should eat, or rather are recommended for you to eat. And there are myths, or rather a few things that you think people should know, or the right type of questions people should ask. So what are they?
This one I will put with a lot of emphasis, because I've had them, I listen to patients a lot, and I can tell what's going on. And the question you want to ask a person is, what are you depressed about? Trust me, they did not wake up and go to the shop and buy a cup of depression.
So these are questions not to
To ask completely.
Okay.
Because then the other thing people tell you, do you know, you're saying you're depressed, look at you, you're well dressed. People don't have food, didn't have a place to sleep. Of course, this person knows. There are people who are hungry somewhere outside and not having a roof over their head.
Yeah.
But it's their time now. They are unwell. It's an illness. Please don't make it worse.
Yes.
I insist.
Okay.
Then there's another one that I've heard about, and it really gets to me. Happiness is a choice. You're saying you're sad. Huh? Why are you sad? You should not be sad. It's a mindset. Eh?
Yeah.
If you try to be a bit positive, you don't get depressed. My friend, it's a chemical imbalance. No matter how many motivation quotes unapatia, that thing will not work.
Yeah.
So don't go to any happiness as a choice.
Yeah.
If you want to help the person get over the certain. It's already there. It's not like we're preventing it.
Yeah.
It's already there. So we try to help the person get better.
Yeah.
The other one that I find like people in the, of course, that's why we're doing the literacy levels. You don't need medication. You just need to go sit and meditate.
And pray.
And actually, a friend of mine, when I told a friend of mine, this is my diagnosis and this is the severity, the person asked me, do you meditate? So, and this is a health worker and with a master somewhere. And I was like, hey, you people, I'm deciding. That's why it's difficult. Sorry, when you come from a point of knowledge, you're able to shun some advice away.
Yeah.
You have to be put on medication. Don't take the medication. This thing, when you start, they'll affect your systems. But trust me, I am here because I made the choice to be on treatment.
Yeah.
And I saw the change.
Yeah.
And if at all I'd turned back hands of time, I'd have sought help sooner.
Yeah.
Yes.
True.
Another thing, when someone has gone through depression and they are out of care now, then one time you meet them again, we started for therapy. You are depressed again. And you're trying to put the person, this person can never get better.
Yeah.
You said depression is treatable.
Yeah.
But now you're coming with your own ideas, you are it again. It's like you're making them feel like they have not done well enough or better. So there's as a Christians, Gladys, or religious people, someone tells you they're depressed, no, do you read your Bible enough?
True.
The word of God cures everything.
Yeah, it is the answer.
Well, you can read back to back the pages of the Bible, but let's also not forget that it's a good book, or even the other religious books that people have using. But don't make a person feel bad because they are unwell, because you're increasing the amount of stress that they're going through. It's not helping at all.
Okay.
Yes.
Okay, Yvonne, and lastly, as we finish up on the topic of depression, what tips would you give?
Well, tips, we have so many tips in this world. And tip number one,
Yes.
we are told exercise.
Yes.
I'm an indoor person. So exercising depends on what you do. I try. It's healthy because it jumps up your system. You can take nature walks. You can do a lot of things, but keep your body active.
Yeah.
That's what's recommended. And the other thing, people talk about journals, structure your day. I knew today I was going to come and see Gladys, and I had to make sure it's in the plan.
Yeah.
So when you have a structured day, I'm going to see Gladys, but Gladys, I'm going to hear, the day goes on, and even you forget.
Yeah.
And of course, there are some things that you do. Apart from journaling, you can have some simple routines to help you. Simple routines can be maybe to check on someone. Maybe you can go feed the ducks. Okay, in Kenya, people don't walk dogs. I don't know what you're going to do, but you'll find something to do.
An activity that's appealing to you.
Yes. You're supposed to stay away from alcohol and drugs. Alcohol is a drug. It has its use and purpose in life. Whoever wants to use it. But it's not good for a person taking who's depressed, because it interferes with the antidepressants. Let's remember this. Alcohol itself is a depressant. So you may find that if it's a depressant, it will depress you more than you're already depressed. And in doing so, you might need more of the antidepressants than you actually require because just of intake of alcohol. We talk about to stop thinking too much. That's why you have to keep yourself active now and then.
Okay.
And also you have to be realistic about goals. I say, I want to be a pilot. Be realistic. It's good to dream big.
Yes.
But don't put yourself in the pressure knowing the grade you got, finances, you have scholarships. Be realistic on the things that you want to do. We want to live, this life is short.
Yes.
We want to live it healthy and have a very good quality of it. Eat healthy. We talked about the foods you can eat.
Yeah.
So eat healthy, avoid junk foods. Eat healthy means you're going to have good, the energy level that you need. If you eat junk foods, of course, you'll have more of oils, unnecessary oils. You can even get constipation and stuff like that. And also you try give yourself time for daily relaxation. Yes, my friend was okay. In a way, asking me about meditation is okay, but give yourself time to relax.
Yeah.
I prefer being in the house, seated, chilling, listen to music, or I go just watch the trees and the leaves somewhere in a park.
Okay.
So that helps me most of
Okay.
the time. Yes.
Yes, our viewers, I am glad that you have joined us for this episode on depression. We have tackled depression at length, and we hope that the tips and guidances that Yvonne has given us may be a help to you and also a step for you to take the action needed to get the right kind of help. Thank you for joining us today. My name has been Gladys Mumbua. Until next time, I will discuss another mental disorder. Bye-bye.